Dr. Selby will give us the details about a revolutionary new cancer treatment option. He will be followed by Dr. Ash, who will give us more information about how patients are reacting to this new therapy based on our experience with clinical trials. Dr. Selby?
Well, thank you, Jennifer. Today we're very excited to be here to announce the availability of a therapy that actually harnesses our immune system to treat cancer. This treatment will be available here at the Stephenson Cancer Center starting tomorrow. It is called CAR T-cell therapy. It's FDA approved to treat leukemias and lymphomas. Leukemias and lymphomas are a malignancy that affect the blood, the bone marrow, lymph nodes, spleen, and liver. The name of this treatment is called chimeric antigen receptor therapy. Now, a chimera is a mythological fire-breathing animal that has the head of a lion, the body of a goat, and the tail of a serpent. In biology, we talk about a chimera because it's one living thing that's made out of two living things. In the case of CAR therapy, it's the patient's white blood cell that has had genetic information injected into it so it behaves differently. CAR T patients will have their blood collected at our colleagues' place at the Oklahoma Blood Institute. The blood will be collected very similar to a usual blood collection, except only white blood cells will be collected. Within white blood cells, there's a subtype called T cells. These T cells will then be treated with a virus that injects new genetic information into them. And that genetic information will have that T cell make a receptor towards molecules that are found on cancer cells. That receptor acts as an anchor to anchor the T cell towards the cancer cell. The T cell then becomes activated and kills the cancer cell. So this really is a rebooting of the immune system to fight cancer. This is how the normal immune system usually works as a sentry to protect us from a malignancy. At the Stephenson Cancer Center, we will be treating advanced leukemias and lymphomas in adults. Within a few months, however, these treatments will be available at the Jimmy Everest Cancer Center at the Children's Hospital of Oklahoma. A patient whose lymphoma has recurred after more conventional therapy, including stem cell transplant, has had very few options to obtain a cure until CAR T-cell therapy has come along. It's an incredibly new advance in the treatment of these malignancies, and the cellular therapy team here at the Stephenson Cancer Center and the OU Medical Center is excited to be able to offer this innovative, incredible therapy to the patients that come to be seen at this center. Thank you.
So good morning. Thank you, Dr. Selby. I'm Adam Ash. I'm Deputy Director of the Cancer Center. I want to thank all of you, staff, faculty, friends, media, for coming today to hear about our next steps in beating cancer. You know, this exciting development of CAR T is really the culmination of work of researchers, clinical investigators, staff, administrative personnel in this institution, all to make this therapy available to patients in Oklahoma. And so it really is an exciting day and the culmination of a lot of hard work by a lot of people to make this available. So harnessing the immune system to fight cancer really has been a holy grail for oncology for many years. And it is the work of remarkable basic scientists in laboratories that have illuminated mechanisms that that the immune system uses to detect and fight cancer. And investigators have taken those observations and used gene therapy techniques to turn T cells into serial killer cells that recognize and kill thousands of tumor cells over and over again. These cells tend to persist in patients for years, and are part of the reason that they're so remarkably effective. The excitement that we all bring to this it really comes from the results of clinical trials that led to the FDA approval of these products. The CAR T cell, as used and as being offered currently in an FDA-approved indication, went through trials in patients for whom conventional therapies had failed multiple times. And the remarkable results of this therapy in that patient population is what makes this really such an exciting therapy to have to offer. And as exciting as it is, we are really at the dawn of an age of new cellular therapies, new cellular immune therapies. There are multiple clinical trials that are going on in looking at other blood diseases and many solid tumors, investigating, for example, the relationship and the role of CAR T cell therapy versus transplant. And many of these clinical trials will be available here at the Cancer Center in the coming weeks. And so, again, I want to thank all of you, and I think we're happy to answer any questions.
Thank you. Thank you, Dr. Selby and Dr. Ash. We are so pleased to be sharing this news with you today. CAR T therapy is a growing collection of resources at the Stephenson Cancer Center, and it is only offered at the Stephenson Cancer Center in the state of Oklahoma. This is a big step in our commitment to providing the highest quality patient-centered, comprehensive cancer care to Oklahomans and beyond.